Today marks an important milestone for healthcare in Saskatchewan.
For people in the world of healthcare, today was a big day. Gone are the province's 12 health regions. In their place, one super authority now tasked with managing the province's 250 healthcare facilities.
From a patient perspective, nothing changes on day one. So the phone numbers that a patient phoned yesterday to access care across the healthcare system have remained the same. The websites, although we have a new Saskatchewan Health Authority websites, all the existing websites where many patients go to access information, particularly around immunization and public health and other services, those are still intact, and that was intentional. And we'll be very careful and thoughtful on how we move that forward.
The government wants to save about $9 million a year alone on salaries. But the new authority is paying out more than $4 million in severance this year to top executives who are now leaving. Still, Livingston says the taxpayers will eventually see some savings.
You're not spending money on 12 CEOs, and you're not spending money on 12 boards of directors initially, so there'll be some offsets. But that's not to say that they would be fully offset. We won't know until ultimately it's done.
One health expert CBC spoke to said getting rid of rural and remote managers is going to be tough, but Livingston insists he will work hard to make sure there is representation from across Saskatchewan. Still, it's clear this is a work in progress. And while today marks the first day of work for Saskatchewan's new health authority, the transition, the one that's supposed to make healthcare more streamlined for patients across Saskatchewan, will still take years, not months. Charles Hamilton, CBC News, Saskatoon.